You just heard from Secretary Sebelius, and she said that the cost of health care is, quote, crushing families and businesses. Of course, you disagree with much of the Democratic plan. What is the Republican plan going forward?
Well, first of all, Robin, the most important thing for us to make sure is that we do increase coverage to a basic plan for more Americans. And the way we're going to do that is by starting with where people get most of their health care, and that's with their employer. And if 70% of the people in this country get their health care through their place of work, we've got to be sure to make it so that those employers can keep their costs down.
There is a new poll as well, Congressman. It says 72% of Americans support a public government-run plan as one of the health care options, and 57% said that Democrats were more likely to improve health care. Only 18% felt that way about Republicans. Does it appear that there is a growing group that would like to see the government take a little bit more control? They feel that the government could get answers where individuals have failed to get answers from some insurance companies.
A government plan, no matter what you call it, will increase costs, it will reduce choices, and essentially it will not allow you to keep what you have. And that is the essence of what the healthcare system in this country is about. That's what families are looking for.
But the Democratic plan would make it illegal for insurance companies to cancel these policies. Again, these are people who have paid their premiums, they got sick, and the Democratic plan would say, no, you cannot do that. Are you ready to say that the Republican plan would do that as well?
Well, what the Republican plan will do is it will look more towards the individual and will say, if you have a plan, your insurer and you are going to determine the length of that coverage. But also, if somehow you lose your job and that's how you get your coverage, we're going to make sure that you've got the flexibility under that plan to take that coverage with you.
Can you tell us how you plan to pay for it?
When you give employers the flexibility as well as the employees and provide some incentive for folks to exercise. If you do that, you are rewarded with lower premium costs at some of these plans. We ought to allow for more competition so that people can have a choice. You can have a choice of what kind of health care coverage you want. Maybe you're young and healthy and you don't want to purchase coverage for hair transplants or other elective procedures, and maybe you just want a basic plan. We ought to allow for that.
Congressman Cantor, have a good day. Thank you.
Thanks, Robin.